Oh, it is that time of year. The coughs are going around. You never know what kind of virus your child could come home with. Across the country, RSV cases in kids are surging. So today, we're talking about the virus, how to recognize it, and what to do about it. So for today's To Your Wellbeing, we're joined by Dr. Michael Cinoman with Cone Health Children's Services. All right, let's first and foremost, a lot of people probably have heard RSV. Maybe they don't know what it stands for. So let's just talk about what is RSV.
All right, sure. RSV stands for respiratory syncytial virus, and it is very simply another respiratory virus, like rhinovirus or the common cold. COVID is a respiratory virus. Influenza is a respiratory virus. These are all called respiratory viruses because they pass generally through respiratory secretions. When we cough or sneeze, billions of little particles are spread out and get in other people's mouth and noses, and that's how they catch them.
Okay, so,
And they typically cause respiratory symptoms, cough and congestion, runny nose, that sort of thing.
So is it just the time of year that we're seeing this explosion of cases, or is there something more to it?
Well, this year there is a little bit more to it. Normally, respiratory viruses are worse in the wintertime when it really gets cold out. We typically see the flu, and we definitely see RSV in small children in the wintertime. This year, we are seeing it much greater numbers, much earlier in the season. And people don't understand why that is very well. But it's definitely the case. It is out in mass numbers.
All right, so are we talking about kids of all ages are at risk, or are we talking more infants and newborns at the most risk?
Well, RSV in particular is what we would call ubiquitous. It's everywhere. Most children, literally close to 100%, have been exposed to it or caught it in the first 2 years of life. So people of all ages get it all the time. And it's typically, again, a relatively manageable cough and cold, like you wouldn't know it from any other cough and cold. It's really the little ones typically that are most at risk for getting what we talk about, which is really difficulty breathing or needing to be in the hospital.
And so do kids get it just like the common cold? I mean, is it just the coughing and the touching and that kind of thing?
Yep, you would never know the difference between it and many other respiratory viruses. They're all in a otherwise healthy, probably, a teenager. You could get it and you'd have your cough, cold, maybe a little bit of a fever, but probably not. It would last a few days and go away. You'd probably be no worse for the wear.
Okay, so that's kind of like a scary thing to me, that that it can develop into something much worse for the younger kids, but it sounds and looks the same until a certain point. And so what is that point, or before we even get to that point, can we know what it is? What can parents or caregivers be on the lookout for?
Well, that's really the important thing, because it's going to be like any other cold. You really can't, even we can't really differentiate between one respiratory virus and another. But in small children, particularly under the ages of 2 and certainly under the ages of 1, it starts with cough, congestion, and fever, but it can quickly develop into difficulty breathing. And what happens is the virus doesn't just stay in your nose and throat, it gets into your breathing tubes, your airways, and causes basically what would be akin to almost an asthma attack. And the pathology is the same. So you've got inflamed airways. Little babies are trying to breathe through these small tubes and having straining and working very hard to breathe. So that's really what parents need to be alert to. The cough, the congestion, the sort of misery, not eating well, fussiness are all very, very common. It's when it gets to be when you notice your child actually having trouble breathing or breathing fast, that's when they need to go see their doctor or seek medical attention, because that is something that can become problematic.
Okay, so either breathing fast or having trouble breathing. So if this is something that happens like in the middle of the night, is this a take the child into the emergency room, or something that can wait until the morning and you call your pediatrician?
Well, everything's a little bit different, and everything is a different shade of gray and difficulty. You can have a tiny little bit of trouble breathing and breathe a little bit fast, or you can be really, really struggling. So parents need to use their common sense and judgment about that. But anytime, I would tell any parent, if you are worried that your child is having difficulty breathing, that is not something you fool around with. Obviously, it can get worse, and children can really develop into respiratory failure and not be able to maintain their breathing on their own. So I would suggest anytime you're really concerned, you should have somebody look at your child.
Okay, and do that immediately, more frequent or more consistent than, maybe we'll wait a couple more hours, it sounds like, if you're really
Well,
worried
again, it's
about.
all like anything else. There's so many shades of gray and so many stages. We wouldn't want to suggest that every parent take every child
Right.
who might be coughing or congested to the emergency department. They would literally be run with children. But again, if you feel like your child, particularly the younger they are, if they're actually having trouble breathing, their chest is working in and out and they're retracting and they're just struggling, or they can't eat or won't eat normally, absolutely have them seen immediately.
Okay, other good points there and signs for you to look at as a parent or a caregiver. We're going to take a quick break. We're going to be right back after a few moments with more on RSV. Well, we're back with Dr. Michael Cinoman with Cone Health Children's Services for today's To Your Wellbeing. We're talking all things RSV. We've been talking about what it sounds like, what it looks like, what parents could possibly be looking for in their children if they have RSV. Let's switch to prevention. Are there certain things that we can do to prevent RSV or reduce the spread, and do they differ by the age group?
Well, this is a disappointing topic because we don't really have very good ways of preventing RSV. It is a highly contagious respiratory virus that is very easily spread from person to person. Unlike the flu and COVID, we do not yet have a very effective, we don't have any vaccine, in fact, for RSV. They've been working on one for many, many years. Some of your audience may have read that there is some bright spots on the horizon where there are some trials that they've been doing for years on pregnant women, vaccinating them for RSV. What that means is they develop antibodies and they pass them along to the babies. So the babies are born literally with antibodies and immunity in their bloodstream. And the study was very good. It turned out to be very effective at preventing severe disease. But otherwise, it's pretty hard to prevent.
Yeah, when you're talking about like school-age kids and preschool kids, I mean, they're touching everything.
They are.
And you can wipe down things only so much.
Good luck. Yeah, it really is. Essentially, there's really not very effective way of preventing its spread. Clearly, early on in COVID, when it was much worse, and the strains of COVID that we had were really very, very dangerous to almost anybody, healthy or not. Thankfully, we seem to have progressed from that, and everybody was isolating and everybody was masking. We saw very little RSV during that time, but that's what it would take. And practically, that's not where we are. So kids are at daycare, they're in schools. Yeah, it just spreads everywhere. It's very, very, very contagious and spready.
Okay, the only thing I'm thinking that like we as adults can do to help reduce the spread is just being mindful once again about the hand washing and not touching things and whatever else.
Sure, and those things are always going to be helpful. I mean, that sort of standard. Wash your hands. Some of the virus is spread by touching things, but mostly it's spread by coughing and air droplets, not actually hand to hand touching things. But all those common sense kind of things are good. But we still watch it spread pretty vehemently especially when children are with other children.
Right, okay. Any recommendations on how to protect one another, especially since we're all going to be getting together for Thanksgiving and such?
Other than the things that you've mentioned, unless you're planning on not getting together and not putting people in the same space. But I mean, practically, I don't think we're really recommending that people do that at this point. We've been through a lot of that with COVID. And I think there is a lot of RSV out there. I would say if you're going to be cautious about anyone, it's really the little ones that are most susceptible. Children under a year or 6 months of age, watching them around people who have cough or congestion is probably a good idea because they're really the most susceptible. But when you're older than that, 3, 4, 5 years of age, I just wouldn't, it is what it is, and people are going to get exposed and get their colds. It's really the little babies we worry about the most.
All right, do we think this surge of cases might burn itself out, or we think it's just going to return to the same kind of high levels as we go throughout winter?
That is another $1 million question. That's a great question. I don't think anybody knows the answer to that. Every time I think it has started to slow down at the hospital and the emergency department, it keeps on coming. sooner or later, yeah, most people are going to get exposed and have antibodies to it. And then probably it will, if you'll pardon the term, burn itself out, and we'll see it less frequently. But right now, it's still going pretty strong.
All right, so be mindful. If you're the one coughing and hacking, you're not going to be touching or playing with the kids at the moment, right? I mean, that is at least something you can do anyway. All right, thank you, Dr. Cinoman. We appreciate your time and your expertise. Lots of good information here, folks. We want to make sure that you have it all. So you can check out the To Your Wellbeing section. We'll have all of the interviews posted shortly.